Hey guys, Dr. John at the Voyage Clinics. Um, this is the Voyage Clinics podcast. Just want to talk a little bit about musculoskeletal stuff. So we live very largely in a society that pulls us forward and down. And so as we're moving forward and down, um, it's really bad for our backs and for our necks, and it can mess with our posture and hurt us in the long run. And so things to fight that. Make sure that we're stretching our pecs and that we're strengthening our posterior chain, so our posterior back and our neck. Lots of chin tucks throughout the day where you pull your chin back like this and pull your shoulders back. Doing lots of great shoulder exercises. On my YouTube channel, the Voyage Clinics YouTube channel, there's some really good videos on helping out with this kind of space. We talk a lot about. A lot of people are out there, they're working on their beach muscles, they're bench pressing, they're military pressing, they're doing some Arnolds and all kinds of shoulder stuff. And they're really, really strong anteriorly, but then their back and stuff suffers. And so as hard as you push, as hard as you push, you need to pull. So consider all those pull exercises. I like a lot of the pulling exercises to the chest, but also forehead pulls. Those are really fantastic. Some lat pulls are great. On my YouTube channel, I talk about VWTAs. Those are isometric strengthening exercises for that whole chain. What's the problem with all this forwardness? It can cause a problem at that T1 junction. And so people will, if you're in your 30s or 40s, you probably woke up like I do, and you can't move your neck. You're like stuck. And it's often a problem right at that T1 junction. And so all of this forwardness can predispose you to injury in that space. And then, osteoporosis, where you got the neck that's really, really far forward. And sometimes just the arthritic changes that can happen if we're constantly forward with our necks. Like we've all seen that, right? In folks where their neck is so far forward and they literally can't pull it back anymore because they're older and they've just been bad posture, bad positioning for so long that they can no longer bring their head back. So lots of chin tucks, stretch your pecs, work on your pec major and pec minor stretching, and then pull like crazy. Do lots of pull exercises. The posterior chain, upper back is one of the most important muscle groups to strengthen. As we age, there are muscle groups that tend to override other muscle groups, and just building muscle mass, I think, is super, super clutch as we age, just to prevent injuries, prevent falls, to prevent, all kinds of things as we get older. And so maintaining strength is really clutch. If we can just get on a basic muscle building regimen a week, you don't have to do a ton, just do a little bit every single week. You're going to build up really good muscle. We do consultations in our office with musculoskeletal strengthening and kind of assess like different areas of the body that might be weaker or stronger and where we need to kind of strengthen and stretch. But those are some common ones, is that posterior shoulders and neck, bring it back, strengthen it isometrically so that it can maintain that posture. And then that will just help a tremendous amount. Another very commonly weakened muscle group in people as we get older is our medial thigh. It's called the VMO, or vastus medialis. It's part of the quadricep muscle. You got 4 big muscles at the front of your leg, and that medial side tends to get a little bit weaker because it's just commonly neglected, as well as the adductors and hips. And so just some really, really interesting muscle groups that if you don't keep them strong enough, then you can end up with some really bad knee pain, which I'm guilty of. For years in med school, residency, and even pre-med, I use exercise as maybe like therapy. I really like to move, and I can't just sit and study. So I would go out and I'd exercise a bunch. But it was all sports. So I'd play soccer, I'd play volleyball, I'd play basketball. I now play a lot of pickleball. And so, you'd have all these problems as you just did that without strengthening, which I did. And so, I don't know. So I developed some tendonitis, and of course I ignored it because I'm a doctor and I'm smarter than myself. And so the tendonitis just created, eventually can become tendinosis. Tendonitis is just a fussy tendon. Tendinosis is a fussy tendon that's now changed, and it's changed structurally, and that is a bad thing. And I had to have like a procedure, do some surgery on my knees, and get all this calcifications in my. So tendons are like a white sheath, and it should be nice and white and clean. And mine had some capillaries growing into them, and they had some just chronic inflammation. They had some calcium deposits in them and stuff, and so we had to go get all that cleaned up. And then I just said enough is enough. I don't want to go through that again. That was miserable. So I started strengthening. I got very, very serious, very rigid on a workout regimen, and I never missed leg day. And I did that today actually. And so always work on my VMO, and just strengthening, and tons of really smart people doing videos on strengthening legs and VMO exercises and all that stuff. But it's the last 30 degrees of extension. I like band work there where anyway, we can go through that another time on another video. But yeah, I would do a lot of exercise regimens just to maintain the body and just to avoid falling, avoid injuries. My dad is in his 80s, and he had a fall 2-3 years ago, and a fall in someone over the age of 65 has a very high morbidity and mortality rate. 5-year mortality rate is really high. So he's actually not doing really well, and then largely because he fell and he broke his hip, and then he got unstable. His muscle mass went down, and then he fell again. He broke his back, and then he fell again and broke his back again. And then, so he's miserable, he just can't do as much. And had he just done some strengthening exercises, maybe prevented that first fall, And so just keep your muscle mass strong, keep it up. And especially into your later years, I think you've got a finite amount of time to build muscle in your life. And so work at it. How do you build muscle? That's a good question. So building muscle is clutch. And one way to build muscle is just to go to failure. So it's not necessarily how heavy you go, it's that you go to failure. Heavier weight does build bigger muscles. That's true. My undergrad at the University of Nevada, Las Vegas was in like athletic training, sports injury management, that kind of thing. And so lots of strength training and stuff there. And so we did all that background. That was fun. So I just try to go to failure. So whether I'm going super heavy, which I don't tend to go super heavy now, try not to hurt myself, but I just go to failure. So just go till you can't go anymore. And then your body is going to have to adapt to that and get bigger and stronger muscles. Consistency is one of the keys to that. And the mind trick of consistency with exercise is tricky. So I think the key is like any habit is just to do it. I like to write it down. Honestly, I think a written plan helps me, because then I go out there and I'm like, what day is it? Oh, it's Tuesday. Okay, well, what's my Tuesday workout? Oh, okay, this is it. And so I've done that, and I did that really consistently for about 18 months, and then I kind of trickled off on my consistency, and I'm like, what's going on? So I looked at it and I thought, maybe it's because it's not as interesting to me. So I worked with a trainer, and we just adjusted the workout a little bit, and it got harder and more interesting. And so now I've changed it enough to make it allow myself more consistency there as well. So move every day, exercise every day, strengthen every day, or as many days a week as you can. I think it's all really, really helpful. Hopefully those are some pearls that'll help you with that T1 junction, posture, posterior chain upper body, posterior chain lower body, that VMO, that medial part of your leg. Super, super important.